Oh, because you had taxes come in at
Sure.
over 38,000, so you got 77,000 plus come in on the excess of revenues over expenses. That doesn't hurt. A lot of that money, though, we know for taxes, that only goes towards capital improvements. So,
Yes.
not salaries, not supplies, etc. So that kind of dollar figure that shows a positive. The operations is kind of what runs the show. The other money that comes in for taxes helps keep the show going by
Yes.
keeping the equipment there. But let people know that overall, though, you didn't lose money in a month to the balance sheet, to
Yes.
to
Yes.
everything. However, the cash flow was way down.
Yes.
And we have to just recognize where it is. As you mentioned, the contractual services, that's what costs a lot of money. The nurses,
Sure.
billing, coding,
Yes.
different things of that nature. And you put all that together, that's going to run that bill up a little bit. That will be going on for a few more months.
Sure. Yeah.
We know that.
And as we see things ramp up with this coronavirus issue, I mean, some of the things that we've and don't get me wrong, it's working against everybody at this point. But some of the things that we have in place with students and having those nursing students in and
Right.
some of our intern programs, those things have all been put
On hold.
on hold.
Yeah.
And so we only have those people in the hospital that we have to have. So employees, visitors, and we'll get to that a little
Right,
bit
that's
later.
good.
But there's a lot of things that's changed. And again, those things we put in place, I mean, we're being affected in many ways. And that is, trying that recruitment, trying to get those students in and do those things. And, some of those nursing programs are being put on hold as well.
Okay,
So,
and so let's talk a little bit about with obviously the expenses here. We've always talked about the cost of drugs and different things and
Yes.
supplies. We all know that right now everybody and their brother is looking for supplies,
yes.
which because of this virus, they may be getting a little bit harder to get and maybe more expensive to get as well if you can find a vendor that has them. Is
Yes.
that not correct?
Yeah, no, and that's very true. We've seen our normal, our normal par levels taxed because you're looking at, okay, we may be ordering masks, we may be ordering other things where we would get, let's just say, 100 of these things, we're being rationed to, a smaller
20.
amount. Might be 30% of what
Yeah.
we're really wanting, or our normal volume, we're being rationed back. And so those are some things that now we have to look at what we're doing in the hospital so that we can internally ration what we're doing as well. And what are those things that we can do that'll save masks for this or that or
Right.
whatever.
Not that you're being cheap, it's just the availability of them.
It is.
Yeah.
It is.
You know,
And so, and it affects volumes. I mean, some of those things, you look at surgeries. I mean, our surgeries, we've basically, our elective surgeries have been put on hold.
Right.
And so that will affect everyone. It'll affect our revenue. It'll affect certain things. And, like everybody, like the mom and pop shops that are probably suffering because of protocols that are put in place that, hey, no more, please, social distancing and all of those things that are going into place. Very concerning, very, same
Yeah.
thing. We are
I
suffering
didn't
with those
measure the
things as well.
chairs here to make sure it's
Yeah.
exactly 6 feet, though. But I think you guys are only 4.5 feet apart, so you may want to. No, but and not to be light about this, there are a lot of different things in place right now that are challenging to the hospital, or
Yes.
challenging because of the normal operations of the hospital that's had to change. We talk about supplies, that's one thing, but like you mentioned, elective surgeries on hold. And we'll talk about it a little bit with Mike about visitation, different things that have changed. But when you start looking at all these things, it kind of throws everything out of whack. You have a daily routine. You know it's going to happen
Yeah.
virtually every single day. Now, you don't know what may come in the door, but you have a daily routine. You show up to the office, you do this, do this, do this. Can't do that anymore because of this I don't want to say virus, but because of the protocol that has
Yes.
to be put in place
Yes.
by the state or federal
Yes.
government, not really even by the hospital. You're just getting told basically by with them, you need to do this, 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 and this. You figure out how to do it.
Yes. Yeah.
You know, and
It
by
is-
the way, you have to do that by tomorrow.
Yeah. And trying to be proactive. Still today there's no positive cases in Dent County, no positive cases in Phelps.
Not that we know of.
No.
Yeah,
I don't
you
know.
look at the
Texas County
surrounding
has
areas. Maybe
Jeff
one.
City.
Yeah, I mean, you start looking at that. It's still not here.
Mm-hmm.
I don't think there's any doubt it will be here at some point. To what degree we don't know, and everything we do today and everything we do as a community to try and do and follow those protocols
Right.
will help us to prevent that spread, or
But like we heard on Missouri Net News just before we got on here, Washington University had a professor and 2 students with it, but they were in Denmark. That's where they got it. They brought it
Yeah,
back.
yeah.
And I'm thinking, well, okay, you brought it back. Why didn't you guys go on
self
lockdown
Yeah.
instead of us hearing about it now? And like, oh, well, yeah, well, maybe we haven't.
Mm-hmm.
Well, when did you come back? Well, 3 weeks ago.
Yeah.
Maybe you haven't. Now, you don't know where they got it from.
No.
And they may have got on a plane. They may have got it waiting in the airport, so we understand we're absolutely just jam-packed trying to get back in. But we don't know that. But again, in our area, as of right now, knock on wood, we don't have any. But that doesn't mean if you get one, that can mean just like the flu is. It could be an explosion if people don't take the right protocol. And that's what I want to talk to Mike about too when we get to it, as to why has to be done and why everybody has to buy in for this to work.
Yes.
Yeah, if 20% of us buy in and 80% don't, well, we won't go there. We'll go there with Mike, because Mike knows all. If he doesn't, he better figure it out. You got about 20 minutes. No, anyway, but because of the obviously down on the cash was $445,000 down.
Yes.
A lot of that is those expenses we talked about, the coding and the lack of some of the money coming in. It's a bit of a blip on the radar that you don't want to see. You know?
No.
But you can't look at it short term. How many times do we say that?
Yeah. We've
Look
been
at it
saying
short
that
term.
for 5 months. So
You're gonna be in trouble. So anyway, there are some positives, and right now, unfortunately, with the coronavirus going out there, that has kind of put some of that on hold. Unfortunately, you just can't do it. But solid balance sheet still for our hospital, and everything else is going on. I can't really beat that. Days cash on hand, we don't want to see it at 35.
No.
But, we know that will improve, and that's just an average for this year.
And we go back to the bond issuance and that is all complete at this point and a done deal. And I think we look back at what we've spent year to date on our the project, basically the expansion project and the MRI project, architects and everything. I mean, and right about $300,000. And again, the board adopted the bond issuance and in order for us to get reimbursed for things that we've spent already, and so we will be getting reimbursed for that. We'll see that this month in the cash. So, we'll see a bump up to that. Again, if those and the first 2 weeks of receipts for the month has been very positive, so I will say that. And then we'll see again our reimbursement from those funds coming.
Sure.
In that
sure. But you have
back
to pay
into
for
operation
things first.
Back into operations,
Yeah.
right?
How many different drawings did you have for the hospital from phase one?
Oh,
I mean, we had phase one. I remember you bringing it in. 2 weeks later, it was changing. Another month later, it was changed. Had some problems with some plumbing. Had to change that.
Yes.
To get some different things. Couldn't do
Yes.
what you wanted to do initially
Yes.
because of the positioning of the rooms.
Yes.
So, yeah, remember the building is from 1968. Is that when that building was built? 68.
Yes. Yeah.
They didn't have Cat 5 or 6 back then, so new things have to be run. you know, when you do that, and we were talking to Mark McKelvey here about the IT, there are some challenges like that. When they
Sure.
run it, that takes time, and every room has to be done. It's not just one room. Well, we're going to just run it to Mike's office. That's all we have to do. Mike's office has to get it. This room has to get it. That room has to get
Yes.
it. This room has to get it. All has to come off a hub. And, you know, you may be running Cat 6 for 200-300 feet
Yes.
down through walls that you have to use a nice little, well, we'll kind of just call it the nice little finder. Get the
Yes.
wire goes up, pull it back through,
Yeah.
get it
Yeah.
down there, pull it out. Or you may have to actually drill into some of those concrete blocks.
And then
So
when you,
much fun.
And then when you go to renovating, I mean that's another thing.
Yeah.
You go to renovating, and you're changing this or that, and it's postponed some of that change today for IT.
Mm-hmm.
But if we, I mean, they're right in the middle of the hospital. So as you start changing things around that, you know, you've got 2 or 3 different larger hubs throughout the hospital.
Right.
Well, if you change where that hub is, that's not just one line.
No,
That's
that's
could be
multiple.
40 lines,
Yeah.
you know. And so, you know, you're looking at, okay, you've got to move this down the hall and into a different closet, and everything has to be changed from that closet to the next.
Absolutely.
And you know, a change of 40 feet is a monumental
Right.
task.
Well, you know, and most of the hospital right now, according to what Mark had said, had been wired with Cat 5, but now you need Cat 6.
Yes.
So you know you have Cat 5, which makes this a little bit easier. You can actually put Cat 6 on the wire and
Yeah,
pull it through,
yeah.
but you still have to go do that, and that takes some time. And of course, the hospital has had some improvements. Obviously, long-term care that part is done there, but the windows that have to come out, now that's been delayed because of coronavirus. So that project was to actually start in March.
March timeframe.
Yeah, end of March, wasn't
Yeah.
it? So, again, put it on hold. Stuff that's already planned, that
Well-
can't go farther this way until that's done. And so it makes
And we'll get to the foundation, but the foundation it is replacing that flooring
Right.
on acute care, the
Not
hallway,
now.
the main hallway.
not till later.
And you know, today we're just having to hustle and change priorities.
Right, with the
And that's-
protocol
yeah.
in place, you can't really do that.
No.
So, all right, very good. Aging of accounts receivable, we know it's 107 days. We know that this is all part of what we've just been talking about. We do know the private pay is high. They're working on that. So
Yes.
we're just beating a dead horse there right
Sure.
now by keep talking about it, but that's exactly what's going on. And again, don't look at today. Don't look at last month. Don't look at the last 2 months. You're going to need to look at a year when they get to it. And finally, they just got started working on this just a few months ago to where they've got finally a system in place. So give it time. I'm thinking by the end of June, you'll really start to see this turn around by the end of the fiscal year. And I think you're going to see a lot of what's going on in this past fiscal year actually coming in by July and August
Yes.
and September. So
Yeah.
the next fiscal year is going to be the benefactor of all these changes that are being made.
Sure.
You think
And oh yeah, no, I definitely agree, and I think that all of the new. I mean, because, you know, when you start looking at the AR, yes, we've got some old AR and we're processing that. But the new AR, the process works as well for the new AR. So those things
Right.
are going to be on track from the very get-go. And so that's what I look forward to that in a few months, saying, okay, the growth will stall out because the correct processing have already been on that new stuff that's coming in. That's
Right,
correct.
right.
And it's not aging like the old stuff is aging. So,
So,
yeah,
but it's called catch-up.
it is.
It's called catch-up.
It is.
All right, very good. Acute care. I always like this report. It just tells you what happens daily that
Yeah.
Debbie brings in, and it shows you the nursing staff that's there and the acuity that's there. And so it's pretty interesting how many nurses are on the floor and the days, and it goes from a wide variety of days. Wow, 26 average acuity per day to average patients per day of 12. We know that that's average. Some days
Sure.
you have 16, 18. Some days you have 5,
Yeah.
6.
Yeah.
Not as skewed as it was last month. I remember we had a couple of days that were absolutely just bouncing off the very top of the charts. But, a little bit more, especially in the last half of the month of February, pretty consistent, within, one or two per day, maybe change, just a little bit more of an even graph.
Yes.
And then you have 10 here and 3, 12, 15, but you never know when people are going to get sick, so you'll love it. And then the flu season update, Debbie did say 285 total cases of flu reported through February. We
Yes.
know there's more. There's been more in March,
Oh, yeah.
but it seems that the CDC stopped taking as many tests in March, which they did last year as well. We had that big spike. And then now with the coronavirus, it seems like more of the focus has been put on that than it has been on the flu. But the flu is just as deadly, if not more deadly, than the coronavirus to some individuals.
Yeah.
So you got to watch that. Are we right there, Mike? Is that right?
Very right.
Okay. I didn't want to leave you out. I know you're still there. If you need more coffee, there's some
I'm
in
good.
there. Okay, very good. All right, Hospital Auxiliary will be having some fundraisers. They are all still on as of today.
As of today, they are still on. Yes, all on.
Okay, so we
Yeah,
have,
and we will be looking at that. Definitely looking at the anything that large number of people, and there may be some limitations what we do with Scrub Hub. So
you may only allow 3 or 4 in at a time,
Yeah.
But at least it's in a hospital parking lot. It's
Yes.
not within the library that
Yes.
you have people inside.
yes,
Okay, so very good. So yeah, that could possibly be done. Hospital Week Barbecue, we know that's going to be coming up. That'll be in May. Hopefully this will all be behind us in May.
Oh, I know.
But the barbecue, that's one that they serve food at the hospital,
yes.
which again we'll figure out
You
what's
know,
going on.
I'm saying there's probably adjustments that can be made as far as carry out. That could be
Well,
like
they've always done that.
Yeah, and they've done that. We've done delivery before, so
Yeah.
I mean that could be something we.
So there may be some highlights to that yet to
Sure,
be
sure.
discussed, to where you may get delivery, you may be able to come out to the hospital, pick it up.
Yes.
Especially outside, walk around the back to the patio, pick up your meal, and
Yes.
you can go and never
Yep.
have to come in a hospital at all.
Yep. That would be.
That would be ideal.
Yes.
Got sidewalks all the way around the building now.
Yeah, that's exactly right.
I do know that.
You are right.
Cost us a lot of money, but I do know that. And you'll be meeting again. Of course, the Shoe Roads production will be in the hospital library May 27th. My gosh, by golly, I hope this has all
Yeah.
been put to rest. Yeah, I'm hoping, and that's why I think, well, we're going to talk to Mike about why this protocol is in place. That's why I'm hoping everybody does what they're supposed to do, and it will all be gone by then.
Yeah.
All right, let's just.
Yeah, and
Yeah.
I do know. I mean, there are some things in May that I know Missouri Hospital Association. We've got the beginning of the summer a leadership forum that we go to. It's a 3-day deal, and I know that's been canceled. So I think they're, as a precaution, they're just canceling it ahead of time. Don't want it to get too close and then have to do something then. But we see that. So
Yeah, something near June, though. If you could push it back a month or two, probably not any harm. I mean, look what they did with the election yesterday. That made sense as of right now when they're telling people to
Yep.
stay home. Why would you have a bunch of people congregate where you're going to vote?
yeah,
That didn't make any sense. And so moving it back to June 2nd, I think is a pretty good idea. And compliment Governor Parson on that because that just makes sense considering what we're in the process of going through.
yeah.
Hospital Foundation is looking forward to June as well. They got a golf tournament.
Yeah, golf tournament.
You're going to stand 6 feet apart when you're golfing.
Hey, you just said by June we're going to be.
I know,
Hopefully,
I
no, I know,
know.
and that's the same. Yeah,
Yeah.
we hope by June we're not having this conversation
I
anymore,
know.
I
think-
hope by mid-April we're done talking about it all together. But,
I hope by early April we're done talking about this. Unfortunately, I have a feeling that won't quite be the case. But I think it could be the case in Missouri if everybody follows suit.
Sure,
I'm
yeah.
not saying everywhere because there are areas that we know are hot spots where a lot of people travel
Yeah.
and they're bringing it in and those people are spreading it. Lock down New York. Don't let anybody out. If you want to do it the right way and lock down the people that all came back in. They're supposed to all be on by their own admission, they
Yes.
should be keeping themselves separated from everything else for 12 to 14 days. However, I know for a fact that that's not happening. You know, and I heard that last night on some news that people coming back to the country just went around and started touring. International students came back and started going through Branson and Springfield. Guys,
Yep.
well, they booked a vacation they were going to take them. Book you a vacation that you won't have to worry about. Antarctica's got a lot of room down there. You can go search all that snow you want, all by your lonesome. It's kind of cold down there too. But right now it's fall down that way. You can go down there. It's a beautiful time of year. I'm not sure about Antarctica, but you know, I'm sure that it might be up to 20 degrees there during the fall. Who knows? Golf tournament, we want to get back to that. It's already raised some funds. Some people have already gotten put their money into it, which is great.
Yes.
You can still get your team in. They got plenty of time to get your team in. Teams of 4. You can get registered. If you did not get a letter, the hospital did send out a letter.
Yes.
If you did not get a letter, call them.
Yeah.
729-6626. They will send you a letter, whether you want a sponsorship letter or a letter to get your team in. It's all basically the same letter. And they can do that. If you want to donate, just donate to the hospital foundation. You can do that.
Fantastic.
Give them a prize or sponsor a hole, whatever you want to do to help out. Wings and Strings are working on getting bands right now, and still that's in the process. And right now, obviously, that's probably a very slow process.
Yes.
And then the USDA Distance Learning and Telemedicine grant that they received. Again, this is probably been put on kind of a hold right now. How are you going to get into schools and talk to them about it?
Yeah.
Because they're not in school. But you do have the initial project performance activity report to the USDA has already been sent in.
Yes.
And so we're just kind of, waiting to do that now to get the field representative here. And
Yes.
who knows how long that might be. And as you mentioned, the acute care hall flooring purchase and installation. Well, you can buy it, but you can't install it
Yeah,
right now.
it's
I don't
been
know
put on hold.
where you would put it. You don't have that much extra
No.
storage at the hospital.
No, we
so
don't.
Anyway, and community perception, a lot of different things still going on. Obviously, some of these things may change, like the stroke support group and
Sure.
the diabetes support
They'll-
group.
Yep.
They may be canceling those for the time being until.
And those communications have been made. So yeah, we have.
Okay, and then
We have
High School
canceled
Career
those.
Day was held, by the
Yes,
way, before
yes.
they closed down. And then the ongoing STEMI and stroke education, that continues, and the CPR training continues. And also, they've got some different things going on. First
Actually-
responder training.
Actually,
CPR.
so, yeah. Actually, both of those
Yep.
things we're holding off. Both
Hold
of those
off on them
things.
too?
Yeah.
All
Thanks,
classes
Mike.
at this time.
Made me look like an idiot.
But the state did say that if your certification lapse, they will.
It's a 60-day extension right now.
Yep. They will extend that. So.
All right. So we've got the COVID-19. I've heard of that. And we're going to talk about that with Mike. All right.
Yes.
Very good.
Yes.
Okay. So very good. So I have some here. Blah, 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 blah. Okay, that's for Mike too. So we're going to leave that there. All righty. Very good. So the hospital has been putting out advertising information about COVID-19, the proper way to do it. We're going to talk to Mike about that as well. Don't just show up to the emergency room if you think you have COVID-19. That's not what you're supposed to do. Or show up at the SMDH Family Medicine. That's not what you're supposed to do. We're going to tell you about that, what you're supposed to do. Or
Yes.
the health center,
Yes.
or anywhere else, for that matter. All right. Now, we'll also talk a little bit about, well, that's all Mike, man. Everything.
Yes,
Man, we're getting to the
everything.
mics. We're getting to the mic part of our meeting. Medical staff meeting was held. You did have one recommendation for courtesy staff privileges.
Yep. Dr. Stadnick, and he is a teleradiologist, one of our USA Radiology teleradiologists.
All right,
So
very good.
That was recommended and approved, and the board passed that.
Very good. And then the home health bylaw change, which we've already discussed. It's been around now for 3 meetings, and I'm tired of it. So they
Me
finally
too.
passed it and got it off the books.
Me too.
Or I guess they added it to the books.
Just had to change the
Small
wording in the bylaws.
But
So
you have
we
to
did
wait
that.
those 30 days. You got to present it for 30 days for comments. And when the meeting falls within the next 30 days, you don't have time to vote on it. It has to get passed to the next one. So here we are. Of course, with February being a short month, does affect things. Very good. So that was done. The Finance Committee meeting, they met March 3rd. They looked over the market assessment. This is what they do. They
Yep.
kind of take a look and see what's going on, not just here in Dent County, the entire market assessment, and also the tentative capital budgets. But some of those, and the key word there is tentative, because you will go around to the department directors, find out if there's anything that now becomes more of a priority.
Yes.
There may not have
Yes.
been when you initially discussed that, and so they're going to move forward with the budget process. All right, very
Yeah.
good. All right, Mike, you're up, man.
All right.
Oh, yeah.
This is the Mike show now. You might want to introduce yourself, Mike, so people know who the heck you are.
Yep, I'm Mike Grunberg. I'm the ambulance director. I also do the emergency management planning at the hospital.
All right, so you've been busy.
Very busy. Everything ramped up about a week ago.
So, what, 20-hour days now?
Oh, not quite that bad.
But pretty much. Okay, let's talk about, we mentioned here just a moment ago, if you think you have the coronavirus, don't show up at the hospital.
That's correct.
Don't show up at your family doctor. Don't show up at the clinics. Don't show up at the health center because they're going to keep you outside, aren't they?
Yep.
What should they do?
They did release the state health department did release a 24-hour hotline that you guys can call.
Okay.
The number is 877-435-8411.
When they
that
call,
is-
what do they do?
That is staffed by nurses. They're going to get to talk to somebody, and they're going to walk them through and tell them whether or not they need to be tested or they're suspicious for it. At that point, they're going to probably tell you to call your provider or call the hospital, and that way we can be ready for anytime they show up. So
They can make a determination on the
Yep.
phone whether you should be tested or not.
for the most part, they can figure it out right
Okay,
then and there.
I
There
know.
are some additional testings that they might want, like a flu swab,
Okay.
to help make that decision. So.
Okay.
But all those would be performed in a. We would want those to be performed in the best environment,
Yep.
and to get that,
Yep.
we have to know you're coming. We have to
Right.
know whether it's you want to come to the clinic, because we're going to route you to a specific area
Right, that's where we're getting
for
to.
testing. So.
Okay, so you had to develop, because this is different from the normal hospital protocol, you had to develop a special area.
Yes,
For
and we've done that in
coronavirus.
both the family medicine, and we've also figured that out for the hospital. We have
Okay.
alternate screening stations, is what we're calling them.
Okay, so as you go, everybody's gone through the emergency room entrance. They've always done that, but if you have coronavirus, you not go in there.
No, we're going to take you to an alternate area right by there. And we've got it set up where we can kind of keep you isolated, where we can do the testing right then and there. Safer for the patients and for the healthcare workers. So
Okay, very good.
Yeah.
So now we talk about healthcare workers. You also have a protocol to make sure that they're healthy, do you not?
yes,
So, I mean, because obviously if the healthcare worker gets ill, they can't. I think that happened in Washington County, if I'm not mistaken. They had a nurse there that had tested positive. Well, anybody that she had seen, then they had to go out to them. So, you don't want to have a healthcare professional testing positive. So, is this a daily test that you do on your employees now, or as they come to shift, or how do you do that now, or what is your plan on that?
it will most likely be going, as soon as we get the first positive case, I can tell you for sure every healthcare worker will be screened probably multiple times a day.
Yes.
So, by temperature. 97% of the people with coronavirus have a fever. So,
Quickly? Does that happen fast? A fever?
within 2 to 14 days of them getting it, usually.
Okay,
They'll
so
say- yep.
that's not the first sign. And a lot of times they say, well, you're going to get respiratory problems.
That's
and
just
heart
the
breathing.
quickest way we can screen for it. So,
Okay. So if they come in without a fever, they're fine.
yes and no. So,
Well, I mean,
Yeah.
if they, obviously if they got coughing and
I understand. Yep.
trouble breathing.
Yeah, we
but-
gotta watch the
yeah,
other
I
signs
mean,
and symptoms also,
I
so,
mean, but just the easiest test is if you have no fever, more than likely you could be okay. All right, very good. So in setting up this coronavirus protocol we're talking about, if somebody calls the state hotline or they call the hospital or they call their family practitioner and they say, I've got these signs, and they ask them the right questions, and they say, you may want to get tested. All this goes through. So what is the test? How is the testing procedure done?
as of right now, if you come in, the first thing they're going to do is they're going to do a flu swab, usually possibly a flu and strep swab. So they can get that very quickly. Within 20 minutes, usually we have that result. We will then call the hotline with, again, same hotline that the public calls we use, but we'll call that also, give them the results of that, and they'll walk through the flow sheet, and they'll tell us whether or not they want them swabbed or not.
if somebody tests positive for the flu, could they also have the coronavirus?
It could be possible. However, they usually contribute that fever and those symptoms to the flu
Okay.
at that point, unless they've had the close contact.
All right.
Then they
so
might
at that
want-
point,
Yep.
you're asking, have you been overseas?
That's
have
where
you
our-
been in contact with anybody that's positive?
Yep. Our other questionnaire questions are
Okay, so there's additional questions
Yep.
that are asked at that time. But 98% or over 100%, I guess, that have been tested in this area, it's all either been flu or nothing.
or some
Okay.
other viral. Yep.
Yep.
Yeah, could be something else. All right, so those people, do you ask them to still isolate themselves from people? I mean, because would their immune system be affected by this, to where maybe they're down a little bit?
Usually the doctors have some guidance for them. I think they need to be down for a few days. Flu lasts a lot shorter than the
Right.
coronavirus from what we're understanding. So I think, I'm not for sure exactly the days that they ask them to stay away, but just the normal isolation procedures.
I think I always remember the flu. Once your fever broke, like 2 days later,
Yep.
you're good. But
And I
you
think
know,
I saw some research on this. It was 5 days for corona after the
Okay.
fever broke. So
Okay, so very good. All right, so you have all the basic protocol in place is call a hospital
yes, we highly encourage the phone call.
Right.
It allows everybody to be ready.
or call your doctor, your primary care
Yes.
physician. Or if you're calling the health center to find out more information, that's fine too. They can ask the same questions.
Yep.
They can give you the same
Sure.
thing, but just do not show up
Yeah, and
in
we can
case
even-
you are positive, because as soon as you walk in, then everybody else
Yep.
can be affected on that. Okay, very good. All right, let me see. There were a couple other things here. Oh, there they are. There's the pages. All right, very, very good. All right, so let's talk a little bit about admissions for people who want to visit the hospital. Have to be changes, obviously, right?
There are changes.
Okay,
They
so-
started yesterday.
Is that part that this is why your job is so easy? I mean, you only have emergency services and admissions. But there had to be changes made to protect the patients and also healthcare workers.
Yep.
Yes.
Okay, so what's the new admission
The
policy for
The-
right now?
Yep. Last week we actually started with long-term care. The CDC recommended that all long-term cares be on lockdown. So we did go ahead and adhere to that. Any of the visitors and staff in there do come in, which the visitors are very limited. It's just a couple of vendors that are coming in right now. But they are screened at the door. That way they can quickly figure out if they're okay to come in. But that's our population that we're really worried about with this virus. So
Okay.
if it happens to get in those long-term cares, that's where you're really going to have the
Yes.
detrimental effects.
Okay, what about acute care?
Acute care also has a high potential. However, we are allowing visitors at this time. There is one visitor per day per patient.
Okay,
So,
so the
They
whole
will
family
also-
can't come in
no.
and gather around.
and that's going to be for the entire rest of the hospital.
Yeah.
Okay,
So one visitor per day per patient, even with an outpatient test.
so is there a flow chart of the people who are coming in? Are they keeping track?
Yes,
of
we are
that?
keeping a log of
You know,
everybody.
in case all of a
Yes.
Yep.
sudden you find somebody says, "Hey,
Yep.
I've got this virus," and you can go back in that chart and say they came in contact with these people in this
Yep.
room.
Yep, we are
And-
completely tracking all that.
Yeah, and all of those visitors that come in will be screened as well. So they'll go through temperature, questionnaire, things like that.
Okay. Okay, very good. All right. Now, what about for patients end of life? We all know that.
Yep,
that
there
can
is an
happen.
exception there. We
Okay,
will
so-
let family members all come back for that.
Okay.
End of life,
Now, are they tested when they come in?
they will all still be screened. So,
Okay. But they're allowed to be a full family, or they have
Yes.
to come back and we all know that that's a very difficult
Yep.
time anyway. And a lot of people there will stay hours.
Yep.
You know,
Yeah.
we
with
all,
their loved ones.
there is an exception for pediatrics also. So
Okay.
both family members or both parents or guardians can also come back.
So how's it been? How's the patients and how's the visitors all reacted to this? I mean, it is a little extra that they have to go through, but has
I
it gone
think,
fairly smooth?
honestly, from employees and visitors, we're getting very positive feedback. So I
Yes.
think this is the one big change item that everybody's on board with.
Okay. So have we tested anybody at Salem Hospital yet? I mean, with the actual test.
We have recently, yeah, there's been
Well, I mean,
yeah,
it's got to
couple,
happen.
yeah, couple.
That just said
And-
disqualified for
and
the
we,
test.
we yes, and we have not gotten back any results yet. So
Okay.
it's been very, very again, usually you get those results back 24 hours. We still haven't got those results back, so yeah.
Okay, well, I mean, people need to know. I
Sure,
mean, if that
sure.
we all, it's still negative. So
Sure,
there's still
it's
nothing
still
here
at this point. That's right.
And at this stage, let's now I want to kind of jump ship here a little bit. Not really jump ship. We're talking about what's on the hospital campus right now, but with the schools locking down, getting the students away from being close to each other. Your residential cares, your nursing homes, they're all locked down. You can't get in them. I mean, you'd have to be National Guard to get in.
And even within those residential cares, those long-term cares, those nursing homes, they're even, isolating them, pretty much isolating
In
them
the
to the
rooms.
rooms.
Yeah.
So,
Right.
Yep.
yeah.
Yeah, I was talking to one person. They said, they got a chance to talk to their parent through their window outside.
Sure.
And I thought, well, great day to do that today out there in the rain. But I mean, that's all that they
Well,
can
we're
do.
working on alternative methods, phones,
Right.
Yeah,
FaceTiming,
you can
whatever we
FaceTime.
can figure out
Well,
to.
but if they show up at
Yep.
the, people still have,
Yep.
it's a hard habit to break when you've been coming to see your mom or dad. And I was thinking back on when my dad was in the hospital, what would I have done had
Yeah.
this happened when he wants to talk to me face to face and ask me questions and this and this. And they say, well, you're on the second floor, your son's down there. On the, hi Dad, how you doing? Looking up,
Yeah.
give him a little phone like they did, can I do in prison? You pick up the phone and there's a phone down there, But I guess what my thing is that there has been a lot of talk that children really don't get this virus, and I think that was just, I think I heard last night, don't go by that because children can catch this virus and they can get very ill as well, but a lot of times they're mostly carriers. But at the same time, when they get sick, is that because of a lower immune system? Is that because they may have some other physical problem, or is it just because this virus has mutated to where it can change?
It could be any
Or
of
all
those.
those.
Yep.
Yeah.
To be honest,
I
yeah.
should have said all of the
Yep.
above.
All of the above.
Yeah. So I mean, this is mutating just kind of like any flu virus is.
From what I understand, yeah.
So it doesn't matter, that somebody in Wuhan, China, got this coronavirus. It's probably not the same one that's here today. Probably not.
Yeah.
Yeah.
Probably not exactly the
No,
same.
no.
Similar, but not exactly the same because it mutates over time and everything. All right, so we've got all this stuff on lockdown. All right, we got the schools locked down. We've got nobody, pretty much no restaurants here are allowing to sit down. Then I think maybe one or two people are still allowed people to come in and sit down, which is okay. I mean, that's fine. No, there have been no positives, so we're good there. Do you, in your opinion, when you see this all happening, if people don't comply to it, how effective can it be?
I think the biggest thing to understand is they're not trying to prevent it from overall getting here. It's the surge that we can't. If we get that big surge, it's going to be detrimental to the community. So we have to keep the hump lower. We have to keep people from getting it at one time. So if we keep everybody separated, it'll help us keep it where we can actually.
Right. So you want it to be a pimple and not a
Yeah,
mountain.
exactly.
Okay.
And
All right,
that's I
so-
think they're
so
very good
if-
at describing that.
So if the kids that are home from school right now think, man, I'm going to go to the playground, I'm going to go out here, and I'm just going to go all over the place, it's not really doing
It's not
anybody any
helping.
good. And the same thing for seniors that they're kind of been told to stay home. They want to go work out. I mean, okay, I understand you want to go work out, but can we hold off a couple weeks, right?
Yeah.
I mean, can you do a little workout at home? And I know you're going to get cabin fever. We all know this. I mean, nobody wants to stay at home and do nothing. But at the same time, it's very important, though, if you get out and your system is compromised or you're senior, and when they say senior citizens is affecting, what age group is that really? Is that 60 and older, 70 and older, 80 and older? Have they limited that, or have they defined that yet, Mike?
Well, they kind of give the ranges of 60 to 69, 70 to 79.
I need to
But I
leave.
think the 65 is kind of what you keep hearing, is 65. At that age, it really does get worse.
And
So,
especially for those who've already had
or
compromisation
yep,
of their system.
immune compromisation, anything like that. Yep.
Or they're fighting off some other type of deal. there's a question about HIV people. If you have tested positive for HIV, you're more likely to get this. Is that true, or has that been defined yet?
You've already had a lower immune system. Your immune system's already compromised, so it would be easier, I think, for them to contract it.
Okay. So that
Yep.
so, and I know HIV has always been associated with a certain group of people. That's not true anymore. It can be anything. So you just want to watch out if you have tested positive for HIV. You don't want to be messing around with this. This could be very, very hurtful.
Definitely need to be
Could be.
quarantined.
Okay, so I guess what I'm saying is, are we doing enough right now, in your opinion? I mean, we've got a lot of this. The groups have been limited. You know, state says, the CDC says 50. Trump has said 10. You know, most of the meetings I've been to, went to the Board of Aldermen meeting, they had everybody separated by 6 feet. Even in the attendance, you know, you're sitting 6 feet apart. Now, I didn't take my tape measure, but I'm pretty sure we were pretty close to it. When you have those type of public meetings, is that still acceptable? Because, you know, here's what I see. You're sitting 6 feet apart, but when you get up to leave, you're all within a foot.
Sure.
Yep.
You know, how quickly can this virus be transferred? Do they have any idea about that? I mean, I know it's the droplets that come out of the respiratory system that are really the big spread. So if somebody in front of you would cough on your back, probably not a good idea.
No. The biggest thing is if they have it, they need to have the mask on. That'll help prevent those droplets from coming out. It's more important for the person that is sick to have the mask than the healthy person. So,
Okay, in case they sneeze,
Yep.
cough,
Yes.
things of
it'll
that
catch
nature.
their droplets.
Okay, so very good.
Yep.
All right, so and masks are hard to come by.
Masks are
anymore,
very hard.
You know, and good luck finding one.
Yep.
And you can't order them, and so there's been a squeeze on that. Is there anything else that you see that will help in the long term? You know, kind of keep this under control. This virus as a pandemic. You know, I know a lot of people, and I maybe kind of made fun of it, because they always said, you know, the rhinovirus is out there, and that should be a pandemic. It's just a common cold, but virtually 100% of people can get the common cold. But we know that this can be fatal. Is there enough being done, I think, locally as well, in your opinion? And I'm not
I
gonna
think
hold you to
the
this.
changes we're seeing are very good so far. Honestly, I see it tightening up a lot more before it's all said and done. Biggest thing is everybody just has to learn to wash their hands again. So 30 seconds.
Or sanitation.
Yep.
But hand washing is the best.
It's the biggest thing. So.
And, okay, so let's explain how to properly wash your hands. Okay, now I know we've all seen this. You go to the airport, right? People coming off the plane, nasty. You know they're full of germs. They go into the restroom, and they don't even do hardly a squirt of soap on their hands. Hit the water, get wet, done. Not clean, are
Yep.
they?
30 seconds. You need to be vigorously scrubbing your
What
hands.
about fingernails? Under fingernails?
Under your fingernails, under your rings is a big one. We see that not getting
I
ever.
never thought about under the ring. And watches. If
Yep.
you wear a watch.
Yep.
Yep.
And you want to go midways up your arm. Make sure you're getting all those germs up there too.
Okay, so it's not just this slap a little piece of soap on
No.
there. Just rub your hands together and you're good, which is what you normally see,
Sure.
right? I'm not being facetious about this.
Right.
Most people really don't know how to properly wash their hands to avoid getting this kind of deal.
Yep.
Okay, so we're talking about clean, warm water. It should be warm water.
Should be hot, I believe.
Hot water.
Well, not burning hot, but hot.
Okay, well, I always heard warm water. Some people said lukewarm water, and I thought, well, I'd rather have it warm water than I would
Yeah.
lukewarm water. They may as well be partly cold. But a good, healthy amount of soap, not just a little slither.
Enough that you can get a good lather.
And in between the fingers,
Yes.
right? They kind of
Between
say,
your fingers.
Can I do the weave? And then
Yep.
one person told me take your fingernails and scrub them on
Yep.
your palm with the soap on your palm.
Yep.
Yep.
So you get underneath the fingernails. And then I never thought about the
Yep.
rings.
The rings is a big
You
area.
know, well, I remember a ring on one person. They couldn't have moved that ring if they wanted to. You know, their finger, I think the ring grew into their finger. It wasn't moving. But again, if your ring is loose enough, pull the ring. Should I take the ring off?
If you can, at least move it so you can scrub under there. Scrub around the ring. So
Okay. And then the watch. So if you've got a watch on or your, I always call it Dick Tracy phone now.
Yes.
You got your wrist phone. Take it off thoroughly. Make sure when you take those off, though, you don't leave them on a counter. And those, by the way, will have germs on them
Sure.
as well.
Yeah.
So how do you, when you go about and put it back on, didn't you just put the germs right back on your hand? Should you put that in your pocket or something, or leave it off for the time being?
Just try not to put it on the contaminated surface if we can.
Yeah.
So,
So
Yep.
put it in your pocket somewhere
If
on
you
your body.
take the ring, if you take the ring off. So,
Ring or the watch off, put it on your body.
Yep.
So don't leave it out there to where it can pick up some other germs. Okay, so 20, 30 seconds. I always heard 20. You're saying 30. Probably 30 will give you a much more thorough clean. But make sure you get the entire hands wherever you have something on. If you wear rubber bands, bracelets, get them off.
Yep.
Get them all the way underneath there, and do that. Now, we've often heard this, and I heard this years ago, and I was, knee high to a grasshopper. My grandfather was a doctor, and I said, I asked him a long time ago, Grandpa, how do you spread the flu? He said, coughing, sneezing, and he goes, and touching surfaces and then rubbing your eyes. And, I thought, well, who would do that? You would go to a surface and then go rub their eyes. And anybody tell you not to rub your eyes? That's when your eyes start to itch, right?
Yeah, sure.
That's just Murphy's Law. It always works that way.
That's how it happens.
So, basically, that wasn't bad advice back in the 60s. But now it actually a little bit more than just the eyes. It's also the nose and the mouth. So, here's a hypothetical. Let's go grab something to eat, and it's on a plate that comes out. And my hands are dirty, and I pick up that sandwich. And I eat that sandwich. That's a good sandwich. But that good sandwich might just make me ill, couldn't it? Because you just moved it right onto the sandwich, right? Not so much fun.
No.
So, now I will say this, in a lot of restrooms I see anymore, either they don't have doors, they have a where they have the way to get in is more like a 2 left turns or 2 right turns to get in, so they have a wall there separating it so you don't have to touch anything. But if you ever come across a restroom, we have to pull a handle to get out. Don't wash your hands and then pull the handle. Guys, don't be dumb. You just went all through that a whole 30 seconds to get your hands clean, took all your jewelry off, your rings, and then you grabbed the handle. Man, oh man. If you have towels, use a towel.
Yep.
If you don't have towels, then try and try and use something over your hand.
Whatever you can.
To get it off. And toilet paper, or whatever. Just try and get enough toilet paper there that you can protect yourself. Not the single ply. One little sheet. Probably not going to do it. But most of the restrooms now I see are either push to get out, open a door to get in, so you can go wash your hands and you can be clean. All right. So very important, though, is to watch what you're doing. Once you clean your hands are good and clean for only a short period of time until you're going to touch something else.
Yeah.
Okay? So is this where you think that the spread of this could get out of control? When you take a look at it, because obviously if somebody sneezes in a room, what is it, 8 to 12 feet a sneeze can go, and it can go on everything? Well, that would not be a good thing.
No.
Coughing, I always say, cough into a tissue or whatever and throw the tissue away. But if you don't have a tissue, crux of the elbow, cough into that. It's on your shirt, but it's not out in the air. But be very, very cognizant of the fact that whatever you sneeze or cough or do, if those droplets come out and you are a positive, you're going to make somebody else possibly ill.
Yep.
So, in your opinion, I'm going to cut you off.
No.
In your opinion, here we are in a commercial service. People come in and out all the time. How often should they disinfect, use a Clorox wipe or something, Lysol wipe, to wipe down their countertops, their keyboards, anything you touch? How often, in your opinion, should they do that?
I'd say kitchens and stuff like that pretty often. I'd say just as much as they need for that area. They say this can, I think the research I read yesterday was 48 to 72 hours it can last on surfaces. Stainless steel and plastic, so.
It was saying cardboard, like 3 days. But,
Yeah, 72 hours what
72
I've seen
hours.
the most now. So
Yeah.
Crazy.
Mhm.
So, when you say cardboard, what always scares me about that is where is it shipped from?
Yeah.
You
Oh, yeah.
know, so after you pick up a box, if it's shipped to you, your mail, wherever it came from.
Oh, yeah.
You know, it could be on there too. Wash your hands.
Wash your hands.
Don't touch your eyes. You know, don't be all excited about the package you get and go through it and then just, you know, start playing with it, whatever. After you open it up, get it out, get rid of the box. Preferably, even though it can last there. And sometimes people don't because they have to return something. They keep it.
Yeah.
Understandable. You may want to put that box off in a corner, get it away from you, but don't touch it again. So basically, daily, at least minimum daily, commercial locations should be wiping virtually everything down.
Yeah. Yeah.
All right. It's a lot of stuff to remember.
oh yeah,
So if we do this for 3 weeks, 4 weeks, you know, the schools have been canceled through April 3rd. Is that enough time? Do you, what you're seeing now and the reports you're getting, if we can isolate everybody for 3 to 4 weeks, would that be enough time to get through this and start to get things back to normal?
we're hoping so. Like I said, we're hoping to. We're back to that hump. We're really wanting to just bring it down. So we can't have everybody getting sick all at one time. So
Okay.
That 14 day is really
Uh-huh.
what they are shooting for, to say
Yep.
we should see some changes
Yep.
in that 14 days. Or after that 14 days, following that 14 days.
As we all know, some people in their immune system, they won't get this no matter what. We know that. It's like the flu. Some people never get the flu. Their immune system is just ideal. They just don't get it. Some people may be ideal this one. You know, not everybody in Wuhan, China got this, you know, even though they live on top of each other,
Yes.
which is why
Yeah.
it spread so quickly, they didn't get it. So there are immune systems out there to do this, but there is no cure to this and no vaccine
at this time, there's some trials that are starting, but that's all. So
So don't think if I get it, I can go get a shot and I'll be good. Doesn't exist. Very good. And it probably won't exist till truly next year. You know, even if they get all these trials done, I mean, I think I read somewhere it's an 18-month trial process they really have to go through before it's FDA approved. Okay. So, all right. If you have questions about the coronavirus out there and you think you may have symptoms, okay, first thing is do not call or do not go to the hospital in the emergency room.
Nope.
Do not go to your primary care physician. Do not go to the health center. Mike, you want to give that number again
Yep.
today and call it a statewide number?
yeah, state number is 877-435-8411.
Okay, if you miss that number, you can call the hospital.
Yep.
Yep.
We'll give it to you.
They'll give it to you. You call the health center. Kendra and their girls will
Yep.
be able to take care of that. Or call your primary care physician. Now, they may have you call health center or hospital if they don't have the time, and that may not be. I don't know if all the primary care physicians have a protocol there, but they
Yes.
should. So they should be ready to go. Again, use a lot of common sense. Guys, stay at home. If you have to go grocery shopping, go grocery shopping. If you know you have the flu and go grocery shopping, put a mask on if you have a mask. All right, because you can make people sick just as easy.
Stay
as-
home and have somebody help you.
Yeah,
Yeah.
if
Well,
you can, have somebody else go.
Can I just want to share a few things that the hospital's doing.
This
just,
is Mike's time,
just,
Casey. You had your
just
time.
to say, if
Yep.
if they see things that are
We've
that,
got
that are
some-
different. You know,
Yeah, no. Go, you
we've
go right
we've
ahead.
changed. You know, we were talking a little bit about students.
Right.
Those students now, you're not going to see those in the hospital right now. We want to keep.
So you want to tell me what the hospital
exposure-
protocol is being right now?
What's that?
What you're going on the hospital?
Sure,
the
sure.
total hospital
So,
protocol.
I mean, we
what
start
you've
with-
done in response to this.
Sure.
Well, you go right ahead.
Students.
It's like you're the boss.
Students. Students. Again, we're limiting those. Again, I think just limiting any exposure for anyone
Right.
is a must. And so, employee health for our employees, any travel, it's all limited to if it's not patient. I guess patient based or patient care based, it's prohibited. So travel that we would do for education or other things. We've canceled all of that. Again, we're
Continuing
trying
education,
to
right, yeah.
to limit and to meet those social, distancing requirements, and trying to keep all travel, and really stay home. Keep us here. We don't want anybody bringing anything back. And
So how about home health? Is this affecting home health? Because nurses go to everybody's house, right?
Yes.
Okay,
Yes.
so can
They're going to be doing pre-screening,
pre-call screenings
yep.
of what's
temperatures.
going on. Yeah,
Okay.
I'm
So,
sorry.
Yep, you're fine.
So,
Man, Mike, he's stealing your
I
I'm
know.
good with it.
it.
so so those things. I think if we have employees that at this point we're not limiting taking time off, so people, employees can still take time off, and they're taking that time off. But if they're leaving the state and they're coming back in, there's certain protocols we're putting in place. They've got to report to employee health to make sure things are taken care of, and we're being mindful of what we're bringing back.
But the recommendation is stay home.
Sure,
Just stay home.
Sure, and
Take
the
a staycation, not a vacation.
yeah, that's exactly right. And if they do go out of the state and they visit one of these hot zones that the CDC has defined as a hot zone, they will be required to self quarantine and to do certain 14-day self quarantine. So, as we start looking at that again, that's a broad 14-day policy. As we start to get more details and find out more details, those things could change. And so,
in all honesty, when you start looking at what our nation has done in virtually shutting the entertainment business down, and I mean that in a number of, I don't mean just shows or sports. I'm talking about even like Bass Pro Shop. They're going to be shutting down. Wonders of Wildlife, those exhibits are being shut down. You've seen a lot of different things shut down anymore. Even shopping, Macy's shutting down their stores. They don't want to do it. We all notice this is going to put a huge burden on the economy. We all know that, right? And people are saying, well, I can't work. I can't get paid. Well, they passed a little stimulus to help that with some people who will be paid for their leave. And I think Mike Parsons has agreed to that too on the state level. Don't ask me how all that's working. I haven't been able to see all that plan yet. But anyway, a lot of people need to understand very, very importantly that the reason they're shutting these down is not because of anything you did wrong. First off, if nobody's going to show up, they can't afford to pay you, and they can't keep it. They got overhead too, just like everybody. We have overhead. You shut the lights off, cuts back on the electric bill. You still got to pay the rent. Doesn't change anything. So there's still a lot of expenses out there that have to be paid. But at the same time, you're not exposing not only the workers but customers to those possibilities of getting this virus. And people will still want to wander in. I mean, I was one when they first started talking about this. It's not here. It shouldn't affect anything you do here. Nothing should get shut down. Nothing should change. It's not the people here. It's the people who want to come through here. Missouri State Parks have shut down events where there are going to be congregations. Department of Conservation now shutting down their nature centers and things of that nature. So anywhere where there could be a congregation of people that you don't know where they're coming from is trying to be squelched by the state to help stop this from ever getting out of hand. What else you got?
So, looking at work schedules, again, we encourage the employees, if because of school cancelings, other things like that, plan your daycare, and I don't know, has the local daycares been?
They're still going.
And so you kind of look at
But
things
they've been
like that.
exempted from this, and
Sure.
I can understand why. But you'd think with children,
Yeah,
that would be, to me, kind of crazy. But that's
I mean, they don't think about washing their hands. They don't think about those things that
Exactly.
we expect adults to do.
Well, they
And so-
pick up and touch everything, and they touch everything all over their body. That's,
Yeah, working from home. We're now reviewing. Hey, what of our employees can work from home? If you can work from home, let's see what we need to do to make that happen. If we can make that happen, we'll do that. Again, our meetings at the hospital definitely have been changed. I mean, yesterday we had meeting, we usually have 30 people at this meeting, and we didn't have that meeting. We did that via telecommunication and over the phone with conference call. And so we took care of all of that,
Okay.
again, remotely. And we're trying to do the things within the hospital that we can do to limit that exposure. And as far as patients go, like you said, call the hospital. We're going to try and triage you over the phone as much as we can to see if you fit in this category. If you fit in this category, we're going to have you report to a different part of the hospital to be assessed, and then
Evaluated.
we'll make arrangements from there to where to go from there. So
Okay. Now I have you on that.
Yes.
Let's remind people the emergency room is still open if you have an emergency.
oh yeah,
Yeah, absolutely.
You know, if you have a nasty cut, you break your arm, you have anything like that, don't call the hospital.
No.
Call 911 and
Yep.
get your
Yeah.
butt over there,
Yep.
right? Or if you have a
Yeah.
stroke or heart attack. We're not talking about calling a hospital to see if it's okay for you to show up. That's not the case. The emergency room is still the emergency room
Yep.
for those types of emergencies, correct, Mike?
That's correct.
and for the lack of a better way to describe it, flu-like symptoms. If you got flu-like symptoms, you need to call. You need to go through the screening to say, hey, what other things could be contributing to this, because we need to make that decision to isolate or to
Right.
get to one of these alternate assessment sites. So
But for severe emergencies, get to
Get to the
hospital.
Yep.
You
Yeah,
know, we've
do
talked
not
about
call.
stroke. We've talked about different things, and you need to get that done in a timely manner for the best outcome.